Why is integration desirable? I don't think this audience needs any schooling here, so I'm not going to repeat these, but integration has been long called for in healthcare, and with good reason. It's the biggest, most complex human system ever devised, a modern healthcare system in an advanced country, and if the parts don't fit together, it creates a lot of difficulties. So for the people who use the system, a system that should at most have some seams to cross, they turn out to be canyons. It's very difficult to get from one sector to another. Some people are left out in the cold, all unintentionally, of course. Authority is dispersed. There is a tremendous amount of autonomy, which in some ways, of course, is a very good thing for professionals. In other ways, if autonomy is accompanied by very wide variations in practice, it bespeaks quality problems. And in today's healthcare system, whatever its problems, no one says healthcare workers aren't working hard these days. Everyone says they're working, in fact, too hard. And the results, sadly, are not as good as they should be in terms of quality, outcomes, and equity. So we get confusion, we get lack of coordination, we have some suboptimal use of system capacity, and the system does a particularly bad job, and this is documented in a lot of research, for people who actually need the system the most. So if you happen to have multiple chronic conditions in particular, the likelihood of your conditions being perfectly managed is pretty low in the Canadian system. The system does a notoriously poor job with the frail elderly. Many of the frail elderly are actively discouraged from joining medical practices. Unfortunately, through the vagaries of the fee-for-service system and the under-rewarding of the higher cognitive aspects of medicine, physicians in some parts of the country put up signs saying, "Come here one complaint at a time," which is not much help for an 84-year-old person with multiple complaints and so forth. Medication use is still dodgy in this country. Many people end up in the hospital because of adverse reactions to drugs, a lot of polypharmacy, and still very little electronic prescribing. So we have these problems, and they're no secret to anyone who observes or participates in healthcare.